when you first start on CPAP therapy, that air feels weird. It's new, it's different, you're not used to it. It's like, whoa, that is weird air. Whether it's too much or not enough, or you're just getting used to it. That is perfectly normal. And that does take getting used to. But that's not the part that I have issue with. The part I have issue with on don't give up or just keep trying is the fact that a lot of times when CPAP users come to their healthcare team and they say, this is what's going on, I can't tolerate it, I'm having this sort of an issue or this sort of concern or that sort of problem, they get told, just try harder. Guess what? That doesn't work. That absolutely doesn't work. Sure, time and place for this is new and weird and different, absolutely. But for all of the other scenarios where a patient or a CPAP user would come and say, this is not working out for me, we need to be highly, highly sensitive to when our patients come or our CPAP users come and say, hey, this is not working out. So the question then is, okay, well, what's going on with it? And let's take air, for example. There's a lot of different problems that you can have with air. Usually when people first start off, it's number one, it's because it's new and weird and different and we haven't gotten used to it yet, right? That's normal. But then it's not enough air, especially if you're set with like an automatically adjusting 4 to 20. 4 is usually way too low for people. And sometimes even 5 is too low for people to feel like they can actually breathe. Or maybe the ramp is set too low or for too long. So if you're laying there in bed and you're like, okay, how much longer until I can actually breathe with this thing on? Like, there's setting changes that can be made, and we shouldn't be making you suffer under the guise of just try harder, just keep going. The other issue is when there's too much air, when the machine, for whatever reason, thinks, oh my gosh, give him so much air. And then you're there and you're like wrestling with your mask. It doesn't want to seal. It's like, it's like wrestling with an octopus. It's just not cooperating. And if you're every night having the machine just crank the whole way to the highest level of pressure that it's allowed to go, especially if you're in automatically adjusting mode, like that's not going to be a good scenario. If every hour and a half or every 2 hours your machine's waking you up because maybe you were in REM and you needed more air and the machine is like, give them more air. And then you wake up out of REM and you're like, wow, that's way too much air. Like, there are things that can be done for that. The last thing, I think the most important thing when it comes to the air is the idea of pressure sensitivity. And this is probably the hot button topic for me when it comes to air and when it comes to people coming to me saying, I can't handle the CPAP, I just can't do it. And they'll say things like, I'm suffocating or I'm smothering. Now, if you give somebody who's saying I'm suffocating or smothering more air without like diving deeper into the details of what's going on, you're gonna make their problem worse, because most likely suffocating or smothering is gonna mean that it's too hard to breathe out. So I always ask my patients, if I'm in a clinic situation or my coaching clients, if I'm in a coaching situation, is it too hard to breathe out? Is that part of your problem? Because just try harder does not work for too hard to breathe out.